Good morning. I just would like to start by saying that most nutritionists go into the field of nutrition because they're interested in food and health, and my entry point into the field of nutrition was through my undergraduate degree at an environmental studies college. So I came to the field because I thought it was a good way to continue studying and looking at environmental issues. And then when I started my PhD research, or my degree, that's when the Dietary Guidelines for Sustainability paper came out, and it was just a great thing to have to hold up as this is why I'm in the field of nutrition. So it's really exciting for me to be here and to have this forum be on this topic. So I was asked to share some thoughts on research priorities, and I plan to do that without showing one graph or one table and very, very little data. And as Gail said in her introduction, my first question that I was asked to address was, has research been successful in connecting dietary guidance, human health, and environmental protection? Well, if you define success as having a tool, as Kate was referring to, in the dietary guidelines as promoting sustainability, then the quick answer is really no. But since I was given 20 minutes to talk about this, I'll explore a little further. And when I started looking at that question, now I didn't learn how to do this. I realized that there are 3 embedded connections in that question, and they have to do with a connection between dietary guidance and environmental protection, between environmental protection and human health, and between dietary guidance and human health. And we do have a lot of evidence, and we heard a lot of it yesterday too, in these individual connections. So I want to explore some of those. Of course, and Kate really explained this very well, we have a long history, a century worth of exploration in the field of nutrition and increasing evidence of the connection between diet and health. And this evidence that is ongoing and accumulating is reviewed every 5 years. And the Dietary Guidelines Advisory Committee reviews the latest evidence and then makes recommendations for improving, for changing, and amending the dietary guidelines. Here is the dietary guidelines that Kate also showed, and we have the icon, the tool for choosing diets in my plate. Food guides are also updated, but less frequently than the 5-year mandatory review of the dietary guidelines. So a number of studies that have informed and provided evidence for the dietary guidelines and for recommendations on food intake have come from single nutrient studies. And these have been very informative in isolating and recognizing the mechanisms involved in how these nutrients and food components affect health and alter the risk of chronic diseases. That's much better understood. But the single nutrient focus, however, has also led us to realize that we oftentimes will need to look not at specific and individual components of food, but actual whole foods and entire diets. And there was a very well-known study that made the news in the 90s, in 1996, that was had to be discontinued. It was a beta-carotene retinol efficacy trial, or called CARROT, that was designed to test the effect of daily doses of beta-carotene and retinol palmitate supplement on the incidence of lung and other cancers and death. Over 18,000 participants were in this study. And what they found, they had to stop it early because the participants who were getting the supplements actually had a 28% increase in the incidence of lung cancer and a 17% increase in death. So this really was an eye-opener to these single nutrient approaches may in fact not be the best way to go for at least some nutrients. And then we also have a fair amount of evidence now that there are other components in food that actually are very protective against chronic diseases. And while these aren't considered nutrients yet, they're not essential for health, they are being recognized as being very protective, and again, in the context of whole foods. So research in this evidence, and it is mounting, can be thought of as falling into one of three and possibly more categories. There is a lot of evidence that is very consistent, and with replications of research, the same message is coming out. There's emerging research, and there's contested research. And I would say, as a nutritionist, you know, people say, well, what's a good diet? Well, some of the things that we've been saying forever, and the public still is not there, is fruits and vegetables in the diet. That's pretty consistent. Whole grains in the diet. A plant-based diet is one that's associated with better health and lower risk of chronic disease. More recent and emerging evidence is in the area, for example, of the types of fat that is healthy, the amount of fat in the diet that is healthy. This is emerging and still not clear. Also, the different components like compounds in foods, phytochemicals. This is an emerging area of science. And there's contested science, and one of the areas is in the calcium requirement. That's an area of contested science, and therefore the advice on dietary sources of calcium. And in particular, hot button right now is whether and how much to include in the dairy group. That seems to be a really hot button and contested in the nutrition community. Also, the vitamin D requirement is contested, and the benefits derived from either heme iron or non-heme iron, iron that comes from meat sources and iron that comes from other sources. And within these debates and contested areas, there's also very important and can be very important environmental implications as well. So the next sort of paired connection here relates to the links between human health and environmental protection. And we heard a lot about this yesterday, but I want to go over some of the connections here. The ag and food system depends on and exerts significant impacts on the natural resources, and through research, there is a growing and substantial body of evidence on these wide-ranging impacts. And if you look at the environmental movement as a whole, it stemmed from, at least in part, a concern over exposures, as harmful exposures to public health through the air we breathe, the water we drink, the food we eat, and what we touch. So these connections between environmental protection and health as it relates to food choices is beginning to be explored. As with the Dietary Guidelines and Health Link, the body of evidence here is also, there's some evidence that can be considered confirmatory, there's emerging, and there's also contested science. When we look at natural resources that directly impact human health that are necessary for a sustainable, safe, and adequate food supply, these include water, air, soil, and biodiversity. And this has been looked at, and Kate also mentioned these in her presentation. The question in terms of sustainable diets is, what are the impacts of food and agriculture systems on the quality of these resources and on public health? And the assumption that I think we all hold is that protection of and resilience of these natural resources is a necessary condition for people to be healthy. So in terms of water quality, this is a good one to start with because it is an essential nutrient, and 70% of our weight is water, so it's something that is very important. We can survive, albeit not happily or comfortably, without food for weeks. We cannot survive more than a few days without water. We have in years of research to draw on in terms of this connection and how agriculture impacts our water quality in groundwater, streams, rivers, and aquifers used for irrigation. And for example, the impacts of non-renewable fossil fuel-based inputs such as fertilizers and pesticides on groundwater and streams and rivers are really well documented. And here is a map that is from the U.S. Geological Survey, found that 70% of domestic and public drinking water wells sampled to be contaminated with at least one volatile organic compound, pesticide, or nitrate from human sources. Another concern regarding this very important natural resource is animal production impacts. And here we have a lot of research that looks at intensive food animal production, and these impacts are very well documented. And many studies conclude that the level of manure, for example, that waste that is generated each year is often too much for the land to absorb, and this leads to runoff of nitrogen and phosphorus into streams and shallow aquifers. This rich resource then becomes a pollutant, and I think that taking a systems view is how do we reverse that again so that the resource that is provided in animal agriculture, in that very fertile element that is created in the production system, how can we use that again in a very beneficial way? So research in this area also has helped us understand that contamination with animal waste is a concern for human and ecosystem health because the waste is often has other elements in it. It also contains pathogens, including antibiotic-resistant bacteria, arsenic, dioxin, and other persistent organic pollutants, antibiotics, and a complex mixtures of hundreds of volatile organic compounds. Research is also increasing our ability to compare, and this is an area that I think should be a research priority, is to comparing different kinds of animal production systems. I show here two that are getting a lot of attention, but also, in addition to that, comparing these different animal production systems with then plant-based sources of protein and the impact of those systems as well to get a more complete question. So air quality, I think we have the same sorts of issues here in terms of air pollution. Research has detailed significant impacts from industrial food animal production, for example. These intensive systems emit ammonia, hydrogen sulfide, carbon dioxide particulate particles contaminated with many different microorganisms. And research has shown substantially elevated rates of respiratory conditions among workers and community members living near these facilities. And this brings up some of that food justice issue, is that oftentimes the damage and the negative health effects from the food system are experienced by people that don't have a lot of voice. So we also have pesticide contamination of air quality. And because our food system is so dependent on fossil fuels, that combustion is also part of the air quality picture. And soil, this is an area that, believe it or not, the nutrition community is really waking up to as a very important. Soil health is very much linked to human health. And I remember in the very, very early issues of various journals, including the Journal of Alternative Agriculture, calling for a broader consideration of soil quality beyond productivity to encompassing environmental quality, human and animal health, and food safety and quality. So it's an area I think that deserves a lot more attention, and research has already helped us understand the agricultural practices affect the soil's ability to provide a range of different ecosystem services. So you think about, well, what do we want the soil to do? Clearly, we want it to produce food. That's the most obvious thing for this forum. But we also want it to improve water and air quality, help mitigate greenhouse gas emissions, which it can do, and enhance biodiversity. And Barbara Burlingham did a fabulous job talking about biodiversity, but I just wanted to, this is my one data slide. when talking about biodiversity, it's really important to consider how much of our food supply is dependent on very, very few species. 12 plant species are used to account for 75% of the total food supply. And when we look at animal agriculture, 15 mammal and bird species account for 90% of our animal agriculture. So we have a bit of work to do in reversing and increasing that biodiversity in our food system. So the next connection is environmental protection and dietary guidance. And this one, I have to say that this has not been a central issue for most nutrition departments. It is not a central issue for my own department at Cornell University. It has not been a central issue for the major nutrition professional organizations, the American Dietetic Association, now the Academy of Nutrition and Dietetics, the Society for Nutrition Education and Behavior, but within both of those organizations and others, like the American Public Health Association, there's a growing and really fast-growing community of nutrition professionals, people involved in health and nutrition that are taking on these issues and for years have been involved in this area. What was it, 20 years ago that the Division of Sustainable Food Systems was formed within the Society for Nutrition Education. So this has been going on for a long time, but still, as a proportion, it's quite tiny. The good news is that a lot of people coming into the field are very awake to these issues. And one of my roles at Cornell is to be the community coordinator for our dietetic internship program. And it has been very interesting to see the interest of the applicants that has changed over the last few years, that more and more of them are wanting this kind of connection to be part of their dietetic training. So we're also nudging the Academy of Nutrition and Dietetics. I sit on a national panel that is looking at developing standards of practice and professional performance in the area of sustainable and resilient food and water systems. Not an easy task, but the fact that they form this committee and want this information, I think, is very encouraging. So when we look at this connection, I think that there are several issues, and these have been covered very well, but I just wanted to look at a few. So we need to consider the diet, the composition of the diet, and here the major thing is plant versus animal-based protein. How much meat should we eat? I mean, we really don't have an answer for that for enhancing sustainable and resilient food systems. In addition to feeding people, what other services do we want agricultural animals to provide, or can they provide, and should we allow them to provide for the most sustainable system? And if we did that, how would that translate into ounces of meat and kinds of meat a day or a week? It would be far less than we currently consume, but what would the level be? It probably wouldn't be zero. And another question is, how do intensive animal production systems compare with pasture-based multi-species systems in terms of their impact on the natural environment and their ability to feed and meet consumer interests in meat consumption? These are areas that are being explored, and some of the findings are quite interesting. How does geographic context influence the question of the meat quantity in the diet? Maybe some areas of the country are more suited for grazing, and the land is not so suitable, as I think Chris mentioned yesterday, for production of other crops, specialty crops. So maybe in those areas, maybe there's more than one good diet, and we could have regional recommendations that capitalize on the natural endowments of the area. And I'm jumping ahead of myself because I'm going to show you one such tool later on. So seasonal variation, if we are, as Kathleen Merrigan suggested, working toward or opening that space for more regional food systems, what can we do around seasonal variation, and what questions might we ask in research? Is there a nutritional content difference if you start varying your diet by the seasonal availability of your area? What are the nutrition and food planning, meal cooking implications of varying the form in which you eat foods so that you're using more stored, processed in the off season of fruits and vegetables, for example, and more fresh when it's available? And what are the environmental impacts of doing that too? Because canning, freezing, that comes with environmental impact as well. So there are trade-offs here. And variety. And when I talk about variety, variety is one of those cornerstones of nutrition advice. Eat a variety of foods. But we actually don't have, in terms of national consumption, and the data, the research tells us this, we don't have a real varied diet. A lot of the vegetable, nearly half of the vegetable intake is made up by potatoes and tomatoes. So we could do a lot in terms of eating more different kinds of vegetables, for example, and more kinds of fruits, for example. But another thing that we really need to look at, especially if we're going to be opening the door to more regional and local food systems, is varieties within each one of those categories. And Ian Merwin, who's a pomologist at Cornell University, gave a seminar recently in our department, and he talked about how on his farm, he has apple orchards, he grows, I don't know, 30 different varieties of apples, and they start becoming ripe in July, and the later ripening ones are ripening in November. So he's looking at this in terms of diversity and how to satisfy a market for fresh apples over a longer extended time. So there's many things we can do here. And this last one has its own slide because I think really this is the big elephant in the room. I mean, when we talk about sustainability, there is so much processing that is energy intensive, resource intensive, and nutrient sucking in the environment. So this paper, and I really encourage you to search for it, Monteiro categorizes foods into 3 different types of processing. Minimally processed, these are foods that you can recognize after they've had something done to them, washed, trimmed, etc. The second group is substances extracted from whole foods, so this would be oils, flours, that sort of thing, that are generally used to enhance group number 1. And then group number 3 he calls ultra-processed foods, and these are shelf-stable, subsidized ingredients, and the profits are really here in the food industry, but the health is really not. Do we need processing? Absolutely. I eat a lot of bread. It's a processed food. But it's the quality and the type of processing that really is the issue here, and whether or not there are inherent nutrients left in the product after it's been processed. So I think this is really the big elephant in the room. The second question I was asked to address, and I'm not going to have time to really go into a lot of this, but food systems research, how can it support sustainable diets? We need more information about the food systems embedded in a food product. And I have my students evaluate food products in terms of what is the food system that food represents, and it's really an eye-opener. Healthy food access interventions, we need much more evaluation on the kinds of activity that's going on and how that's really working. Relationships between food skills and waste. There's a lot of work we need to do on food skill development and its result on food waste. Food waste has been mentioned many times at this conference, and rightly so. Comparisons between highly concentrated food systems and local and regional food systems, and the social costs of the food systems. Social costs of what is grown and how it's grown and where it's grown. The social aspect of this research is so important. So I wanted to give you a brief overview of work that I did on dietary guidelines. This was in the mid-90s, to look at, well, what would it maybe a food guide look like if we were promoting a regional food system? And the dietary guidelines, as Kate mentioned, is to promote health and reduce chronic disease, so we need to reinvigorate that and kind of open up that concept of dietary guidelines to promote health, reduce chronic disease, and increase sustainability and resiliency. So the other, a food guide also needs to be redefined, and this is a definition. A food guide translates recommendations on nutrient intake into recommendations on food intake. It provides a conceptual framework for selecting the kinds and amounts of foods of various types which together provide a nutritionally satisfactory diet. So that we need to broaden that definition, because the dietary guidelines are extremely important in terms of food use in the food system. They provide the nutrition standards for food assistance programs that use a lot of food, school meals programs, WIC, Child and Adult Care Food Program, and SNAP Education. And they have the possibility of affecting the sustainability of the food system, but this is really largely untapped. So one of the things that I think is important is to develop a framework, or my department loves conceptual models. So develop a conceptual model about how do we develop dietary guidance. So of course we would always have dietary guidelines and a food guide based on what we know about the relationship between diet and health. We also would bring to bear communication research, communication theory, and behavior change theory. What we don't currently have, and what we would need to make a tool that really was about sustainability as well as health, would have information about seasonality, variety of regional production, and a whole host of sustainability criteria and evidence. This would lead to food choices, maybe, as Kate suggested, and these choices are always moderated by individual factors, preferences, food histories, all sorts of individual characteristics, and environmental factors. Are the food choices available at the store that I can walk to or take the bus to? But regardless of that, we're looking for food choices that do two things, that promote optimal health and disease prevention, but also the sustainability of regional food systems. So I'll end with this image. This is the Northeast Regional Food Guide that I developed in the mid-90s, and it was based on the 1992 Food Guide Pyramid. And what you see, you don't see any oranges on this pyramid, or bananas. These are fruits and vegetables that are from the region. I also, if you remember the 1992 version, it had symbols for fats and sugars at the top, but we put actual foods in there of syrup, butter, canola oil, other things, jams, jellies, because these are agricultural products, they're economic drivers in the region. So this is one way of embedding context, a geographic context, into a food guide, and this might be one of the ways to lead us toward more regionally based sustainable food systems, as Kathleen Merrigan suggested that we do. And I'll end there so we can get to questions.